I am Dr. Shashi Kanth, orthopedic consultant working at Star Hospital's financial districts. Today, we are going to talk about a clinical condition called frozen shoulder. This is a very common problem which people come across, mainly caused by patients suffering with diabetes. So what happens in frozen shoulder is the whole of the shoulder becomes very stiff and the terminal activities of the movement usually gets very restricted. So the patient will usually complain of initially pain in the shoulder, that will be followed by stiffness, and then he'll have both pain and stiffness. So he'll encounter problem in his day-to-day activities like combing his hair, eating his food, taking out his clothes. So because of the pain, and he also gets some disturbed sleep because of the stiffness. So the treatment and the diagnosis of this condition is very clinical. So there is no need for any investigations to diagnose this condition. When the patient is examined in the clinic, we find that the shoulder movements are restricted. They're not normal compared to the other shoulder. And frozen shoulder is a clinical diagnosis. It doesn't need any extra investigations. So once we diagnose the patient with frozen shoulder, we usually tell him or her about the clinical condition and the way it progresses. So the most important thing to tell a patient who comes with a frozen shoulder is this condition is going to last for about 6 to 9 months, and this is usually a self-limiting condition in the sense it usually recovers on itself. But the line of treatment in this situation is basically pain relief, which we can provide with regular physiotherapy, where patient will have some ultrasound therapy for the shoulder. In some situations where the pain is not controlled with physiotherapy and painkillers, we usually give a local steroid injection into the shoulder to relieve the pain and help him with his night discomfort. In conditions where the shoulder is very restricted, where they find it very difficult to do the activities of daily living, we usually perform a procedure called manipulation under anesthesia, where the patient comes into the hospital. We give him an anesthetic injection in the shoulder to relieve the pain, and we manipulate the shoulder so that the shoulder stiffness is relieved. In some situations where this condition is where the bones are very fragile and we probably feel that there is a likelihood of a fracture, we usually do what is called as arthroscopic adhesionolysis, where the surgeon usually puts a telescope into the shoulder and releases all the fibrotic tissue in the shoulder to get his range of movements back. Both these procedures are very commonly done and yield good results. So frozen shoulder, or also known as periarthritis, which is a technical term for it, is a common condition and which is commonly seen in diabetics. Its treatment is based on physiotherapy and surgery if needed, and proper control of diabetes is very important and paramount for the relief of this condition. Thank you.